Hey guys, welcome to Can Baby Surrogacy. My name is Ethan. I'm a senior embryologist based in North America. And on this channel, we talk honestly about IVF, genetics, and affordable surrogacy options for people who feel stuck by cost or long waiting times. If you need help or would like to talk about your situation, just click the link below this video to book a consultation. Today, I want to talk about a question I get all the time, which is, should I choose IUI or IVF? And what's the real difference between the two? A lot of people casually say IVF center, but in reality, most clinics around the world are not actually called IVF centers. In China, they are usually called reproductive medicine centers. And in North America, they are called fertility clinics. And that's because IVF is not the only treatment they provide. One very common option besides IVF is IUI, which stands for intrauterine insemination. In simple terms, IUI means we collect the sperm, process it in the lab to remove weaker sperm, and place the healthier sperm directly into the uterus right before the ovulation, hoping fertilization happens naturally inside the body. That's a key point. Fertilization still happens inside the body. IVF is different because both eggs and sperm are taken out. Fertilization happens in the lab. Embryos are created and then an embryo is transferred back into the uterus, which is why it's called in vitro fertilization. In both China and North America, doctors agree on who IUI is actually for. It's only suitable for couples whose test results are completely normal, meaning sperm parameters are normal, tubes are open, ovulation is normal, but pregnancy just doesn't happen. If either partner has a clear medical issue, like no sperm quality or blocked tubes, IUI usually doesn't make sense, and IVF is a better option. Now here's a part that surprises many people. Even though IUI patients often look medically normal, the pregnancy rate per cycle is usually around 10% or even lower. IVF, on the other hand, commonly achieves pregnancy rate of 15% or more, and in well-managed clinic it can reach 16% or even close to 17%. So even though IUI patients are healthier on paper, IVF still works much better. That tells you IUI is a much simpler and more limited technique. Then people ask, if IVF works so much better, why do clinics still offer IUI? There are a few reasons. First, it's a cost. IVF is expensive. In China, one cycle often costs 13 to 15,000 RMB. In California, it can be around 13,000 US dollars, and in Canada, roughly 15,000 Canadian dollars per cycle. IUI, on the other hand, costs about 1/10 of IVF, so many couples feel more comfortable trying it first. Second, IUI is much easier on women. IVF involves hormone injections, frequent blood tests, ultrasound, and egg retrieval surgery, sometimes with anesthesia. For men, IVF is easy. For women, it's not. IUI is much simpler, with fewer medications, no egg retrieval, and much less physical stress. Third, fertilization happens inside the body. Many people think modern medicine can do almost anything. But in reality, medicine is far more limited than most people realize. In IVF labs, embryologists are not creating life. We are simply trying our best to imitate the natural environment of the body. The highest goal of IVF technology is not innovation, it's imitation. With IUI, fertilization and early embryo development happen naturally inside the body. So some people feel more comfortable starting there. There's also an interesting difference between China and North America. In China, regulation usually requires couples with normal test result to try IUI 3 times before IVF is allowed. But in North America, IUI is optional. Doctors may suggest it, but patients can choose IVF right away. This difference is not about technology, it's about philosophy. China tends to be more cautious, while North America generally considers IVF safe and well established. Neither approach is completely right or wrong. As reproductive medicine developed, discussions about safety and effectiveness will continue. but one goal never changes: helping families responsible and honestly. If you found this video helpful, please like and subscribe. And if you're exploring IVF, donor egg IVF, or affordable surrogacy options, you're welcome to book a consultation using the link below. Thanks for watching, and I will see you next time. Bye.